Hello, I'm Dr. Joseph Raffaele, your host of the Telomere Summit. Today, I'm very pleased to be talking to Dr. Gordan Lauc. If you're interested in telomere biology and its clinical applications, I guarantee you'll be fascinated to hear about glycobiology and specifically how IgG glycans can help you take better care of your patients' aging processes. Welcome, Gordan.
Thank you for the invitation. I work in the field of glycobiology for, I think, over 30 years now. And we established a field called high throughput glycomics, where we started to analyze thousands and thousands of glycons from different people. So kind of similar to personalized medicine, we are trying to do personalized glycomics. And we already analyzed over 150,000 people. And by analyzing so many people from many really well-characterized cohorts from all around the world, we learned that glycans attached to immunoglobulins are highly correlated with aging. And here I would like to stress one very important aspect, and this is that glycans on immunoglobulins and our glycan age, they're not only a biomarker. For example, if you talk about epigenetics, methylation on a specific CpG site is just a biomarker. We don't know anything about its function. And people, original Steve Horvath's epigenetic clock is something like, I think, 373 CpG marks. Glycans are functional effectors. So these are molecules which either suppress or promote inflammation. So if somebody has more of these glycans which suppress inflammation, we know that inflammation level will be lower. And if there is more of these glycans which promote inflammation, we know that they're actually promoting inflammation. And now we know that this low-grade chronic inflammation is behind so many different chronic diseases that actually we can be very confident that having a lower glycan age is something which is good, which is associated with a lower risk of a disease or a milder disease. And something else which is also very important, when we look longitudinally, glycans usually change first. In some diseases, they change up to 10 years before the disease is actually diagnosed. Because, disease, this is a name which was given by physicians for a condition when people appear to the hospital because something does not work. There is pain, some organ doesn't function, and then you get a disease name. This does not happen overnight. This is a long process where the body is first trying to compensate for a problem, and then when all the compensatory mechanisms fail, there is disease. And glycans and immunoglobulins are one of the early things which happen. So before you get ill, your immunoglobulins become pro-inflammatory, they start to do damage, and well, we haven't proven it in humans, we have some evidence in animals that if you improve glycans, disease does not happen. For humans, we only have correlation, glycans change first and then the disease appears. Problem is that we all think that we are fine. Now, you look at yourself in the mirror, you are same as yesterday, you don't see anything, and unless you have some kind of pain, and even if you have, you can take a pill and the pain goes away, and you just go on and go on and go on, but there is a wear and tear in your body which you cannot see. And then usually, at least for men, we stop after the first heart attack or stroke, but then it's often too late. So ideally, I want to get an early warning signal to tell me, you're not going in the right direction. And I don't want to wait for 20 years to get the feedback.
Right.
I want to get feedback as soon as possible. So if I start losing my weight, I want to see an effect in a couple of months. And if it's not working, then I can try something else. And this is where I see a huge potential of this test, which we have developed, is that to help people motivate themselves to do a difficult decision, because skipping that extra cookie is a difficult decision. Skipping that extra beer or whatever is a difficult decision, and people need rewards. And if you get the reward after a few months, you see your glycan age is going down, I think it can help people. That's kind of an idea.